Hello, everyone. My name is Stephanie Myers. I'm a PhD graduate student in the lab of Dr. Randall Davis, and my presentation today is called Protective Effects of Beta-Funaltrexamine Against LPS-Induced CCL2 Expression and Behavioral Deficits. In the United States, anxiety disorders are the most common neuropsychiatric disorders with various symptoms, ages of onset, prevalences between males and females, and there's also a high comorbidity rate with other psychiatric disorders. Now, there are current anxiolytics on the market, such as benzodiazepines and selective serotonin reuptake inhibitors. However, like most medications, there are complications, and those can include things such as adverse side effects, as well as limited effectiveness. And when I talk about neurological disorders, please keep in mind that there is a wide range of disorders, and those can include things such as infections, such as encephalitis and meningitis, neurodegenerative diseases such as Alzheimer's and Parkinson's, and psychiatric and mood disorders such as anxiety and depression. And I specifically focus on anxiety. However, all these disorders actually have something very interesting in common, and it is in fact inflammation. I also want to touch base on peripheral conditions such as splenomegaly, cirrhosis, inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease, because they also share a very interesting common factor, and it is in fact inflammation. So I want to propose this concept of B-FNA as an alternative treatment. We spoke about neurological disorders, peripheral conditions, and how a common factor shared is inflammation. We also mentioned how there are current medications on the market. However, there are complications and limited effectiveness that come with them. And it is for this reason that it's important to continue to research and look for agents that are well tolerated. And this is where beta-phenyltrexamine, B-FNA, comes in. B-FNA is a irreversible selective mu-opioid receptor antagonist, MORE for short, that cannot be competed off and will bind permanently to the receptor. B-FNA is also known to readily cross the blood-brain barrier and is well tolerated. B-FNA has inhibited inflammatory signaling in vitro as well as in vivo models. And for this specific project, we used male and female C57 black mice and an LPS dose of 0.83 milligrams per kilograms IP. And this is a well-established dose based off previous literature. We also used beta-FNA at a dose of 50 milligrams per kilograms IP, either immediately or 10 hours post-LPS. This was then followed by an open field test, which right there it is. And this open field test is set to assess for sickness-like behavior. And here, what you're going to see is it's a box. And within the box, you're going to place your mouse. And if a mouse is showing normal behavior, they're going to walk around, they're going to explore, they're going to have an increase in this locomotor activity and exploration. Whereas if a mouse is showing sickness-like behavior, they're not going to do this. They're going to stay closer to the corners, closer to the walls, and they're not really going to venture out into that open area, nor are they really going to have that increase in movement. We also conducted a 5-minute elevated plus maze test to assess for anxiety-like behavior. And the way that this works is that it's basically a T-shaped maze that's elevated. And if a mouse is showing no anxiety-like behavior, you're going to see that there's these 2 opened arms within the T-shaped maze and 2 enclosed arms. So no anxiety-like behavior, the mice are actually going to walk out into that opened area. Whereas if they are showing anxiety-like behavior, they're going to actually walk and stay within that enclosed arm area. Now, bringing it back to the effects of beta-FNA on LPS-induced sickness-like behavior, this was using an open field test, and we used specifically distance move to assess for this. We had 4 different groups. Group 1 was our control in white, LPS only in black was group 2, and group 3 was LPS plus beta-FNA immediately post-LPS in teal, and group 4 was LPS plus beta-FNA at 10 hours post-LPS, shown in the gray bar. Now, for sickness-like behavior within the 24-hour time point, which is when we assess these mice, we are believing and expecting sickness behavior to have begun to wane. And that's actually exactly what we're seeing with our males. We can see that there's not much of a difference going on between the groups. However, with our females, we see that that's not the case. We're seeing that there is a decrease in distance moved, not only within the LPS group, but also the groups that received the treatment. Now, when looking at the effects of beta-FNA on anxiety-like behavior, here we used cumulative duration in the opened arms. So that is how long the animals were within that opened area. And you can see that for our males within the LPS group shown in that black bar, that is showing a decrease in that cumulative duration, which is indicating that there is some level of anxiety-like behavior. And that asterisk is actually indicating that there is a significant difference between that bar and that of the control bar, which you see in white. And in this case, for males, you also see that there's a level of protection by beta-FNA regardless of the timing of the treatment. For females, there's not much of a difference going on. However, in this case, the only thing that we can note is that hashtag or pound sign that you can see above the gray bar for the females that is indicating that that is significantly different than that of the LPS bar. And to continue our experiment, as I mentioned, we used male and female C57 mice. We gave them an LPS dose followed by a beta-FNA dose either immediately or 10 hours post-LPS. We also then did a 10-minute open field test followed by a 5-minute elevated plus maze test. And immediately after, we collected the whole brain, prefrontal cortex, hippocampus, and the cerebellum. And from this, we used an ELISA to assess for specific cytokines and chemokines of interest. However, in this case, I'll only be speaking about CCL2. We also collected plasma, used an ELISA, and looked at CCL2. And we collected the spleen, the liver, the proximal small intestine, the distal small intestine, and the large intestine. And once again, used an ELISA to assess for CCL2. And what we're going to see here when we're looking at the effects of beta-FNA on CCL2 expression within the whole brain, let's start off with the males. So for our males, we can see that increase of CCL2 within the LPS group, and we're also seeing that beta-FNA is not protective at this time point. Whereas for our females, you still have that increase of CCL2, but beta-FNA is in fact protective when administered 10 hours post-LPS. In the hippocampus, there's not much of a difference going on between the groups, regardless of sex or treatment. In the prefrontal cortex, males follow a very similar trend as the hippocampus, whereas females are showing that increase in CCL2 within the black bar, which is our LPS only bar, and no protection by beta-FNA regardless of the timing of the treatment. And within our cerebellum, we're now seeing that increase of CCL2 within the black bar and protection by beta-FNA, and females are not showing much of a difference between the group. And that delta sign that you're seeing within the LPS bar of females in the prefrontal cortex and the cerebellum is saying that that is significantly different from the LPS bar from the males. We also looked at the effects of beta-FNA on CCL2 expression in the periphery. Starting off with the plasma, we can see that males are showing that increase of CCL2 within the LPS group and protection by beta-FNA at both time points. Not much of a difference in females. Spleen, very similar trend to plasma, increase of CCL2 in the males, LPS group, protection by beta-FNA, and females are not showing much of a difference. And within the liver, once again, for the males, increase of CCL2, protection by beta-FNA at both time points. But for our females, we're now seeing that there is, in fact, an increase in CCL2 within the LPS group, and beta-FNA is not protective at this time point. And across the board, for the plasma, spleen, and liver, you can see that the LPS bar within the males is significantly greater than that of the females. We also looked at the intestine, specifically looking at the colon. Now we're seeing that for males, there's that increase in CCL2 within the LPS bar, and we do in fact have protection by beta-FNA. Not much of a difference between groups for females. In the proximal small intestine, for our males, we do have that increase of CCL2 in the LPS bar, protection by beta-FNA immediately after, and not much of a difference going on for females. For our distal small intestine, in this case, we have an increase of CCL2 regardless of sex within the LPS group and protection by beta-FNA regardless of the timing of the treatment. So to conclude, we did have differential effects. We had them within the whole brain versus brain regions, central versus peripheral effects, sex effects, and we also had behavioral effects. Moving forward, the lab is set to further assess the temporal effects of beta-FNA on neuroimmune signaling and explore beta-FNA's effects on more knockout mice. And I, of course, would like to thank everybody within my lab as well as my funding. Thank you.